An estimated 250,000 Americans die every year from preventable errors and infections inside hospitals. That makes hospital safety problems the third leading cause of death in the United States, right behind heart disease and cancer. And in 5 states, those odds get significantly worse. One of these states spends more per person on healthcare than 45 others, and still ranks dead last in outcomes. Another state just had a 19-year-old die in an emergency room that was staffed by a single nurse practitioner with no emergency training. And the state at number 1? Its infant mortality got so bad, the government declared a public health emergency. If you are in one of these states, or thinking about moving to one, this is not optional. Subscribe if you like knowing things before they cost you. Let's break it down. Number 5, Oklahoma, where emergency rooms run without emergency doctors. Oklahoma sits right in the middle of what healthcare researchers call the mortality belt. It ties for 48th on the Commonwealth Fund 2025 scorecard, and it ranks dead last in the country for nurses. Only 30.01% of Oklahoma's primary care need is being met. Nearly 70% of the shortage just sits there, unfilled. The state has a 31% nursing shortage, a deficit of 12,920 nurses. 47 rural hospitals, 61% of all rural facilities, are at risk of closure. Employee out-of-pocket healthcare costs eat 14.4% of median income, the worst ratio in America. In August 2025, a 19-year-old woman walked into an Oklahoma emergency room and never walked out. She was misdiagnosed by a nurse practitioner who was working alone, certified in family medicine rather than emergency care. The case became a national flashpoint for doctorless emergency rooms where no actual physician is on site. And if you think an emergency room without an emergency doctor is bad, the next state cannot even keep its hospitals open long enough to have that problem. Number 4. Arkansas, the state where 2/3 of rural hospitals may vanish. Arkansas ranks 48th on the Commonwealth Fund and 49th on America's Health Rankings 2025. Median household income sits at $62,106, among the 5 lowest in the country. The rural hospital crisis here is the worst in America by percentage. 50% of Arkansas's rural hospitals are vulnerable to closure, the highest proportion of any state. Becker's Hospital Review put it starker. 31 rural hospitals, 66% of the state's rural facilities, are at risk. 12 face immediate shutdown. Maternal mortality runs between 35.3 and 38.3 per 100,000 live births. The Commonwealth Fund compared the state's neonatal mortality rate of 5.5 per 1,000 to Peru, not to a neighboring state. To Peru, only 52.77% of primary care need is met, and there is a 16% nursing shortage. Arkansas expanded Medicaid in 2014. Imagine what these numbers would look like if it had not. If you thought spending more money would fix this, the next state proves that theory catastrophically wrong. Number 3. West Virginia, the state that spends the most and gets the least. West Virginia spends $12,769 per person on healthcare, more than 45 other states. And it ranks dead last on MoneyGeek's 2026 healthcare analysis, with a cost-performance score of 0.0. Not low. 0. The preventable hospitalization rate is 3,954 per 100,000 Medicare beneficiaries, the worst in America. That is 43% above the national average and 2.58 times Idaho's rate. Diabetes prevalence is 18.4%, the highest in the country. Life expectancy is 73.9 years, the shortest of any state. Emergency room visits are 596 per 1,000 residents, nearly triple Nevada's 226. And here is the part that deserves more outrage. The state's hospitals are licensed for roughly 6,700 beds. They can only staff about 4,750, and that number has dropped another 15% since. People are not flooding emergency rooms because they want to. They are going because there is literally nowhere else. West Virginia is bleeding money and people, but the next state does not even have that excuse. Louisiana just bleeds. Number 2. Louisiana is the least healthy state in America, 4 years running. Louisiana is synonymous with culture, music, and food. It is also synonymous with ranking dead last on America's health rankings for the 4th consecutive year. Its composite health outcomes score is -1.003, the lowest of any state. Median household income is $60,986, the 3rd lowest nationally. The premature death rate is 12,180 years of potential life lost per 100,000 people. Preventable hospitalizations are 3,451 per 100,000 Medicare beneficiaries, 25% above the national average and more than double Idaho's rate. Maternal mortality ranges from 37.3 to 58.1 per 100,000. The Commonwealth Fund put it plainly. The risk of dying from pregnancy-related causes is more than 4 times higher in Louisiana than in California. The state has a 15% nursing shortage, and more than half the population lives in a federally designated health professional shortage area. A nurse who relocated to Louisiana posted online that, despite having a great boss, she hates the way nurses are treated there. Louisiana was independently ranked as having the worst work environment for nurses in the country. You cannot fix a healthcare crisis when the people trained to fix it do not want to be there. If Louisiana being dead last for 4 straight years seems like rock bottom, the next state found a way underneath it. Number 1. Mississippi dead last and declaring emergencies. Mississippi ranks 51st out of 51 on the Commonwealth Fund 2025 Scorecard. That is all 50 states plus Washington, D.C. Mississippi is last. Median household income is $59,127, the lowest in the nation, roughly $21,000 below the national median. Mississippi has 178.6 physicians per 100,000 residents, the fewest of any state, barely half the national average of 254. Massachusetts has 362.1 physicians per 100,000, more than double. Infant mortality hit 9.7 per 1,000 live births in 2024, nearly double the national rate. For black infants, it is 15.2 per 1,000, a 24% increase from the prior year. The State Department of Health declared a public health emergency, not a typo. A public health emergency over babies dying. Maternal mortality runs between 39.1 and 50.3 deaths per 100,000, more than 5 times California's rate. Life expectancy is 70.9 years. A child born in Mississippi can expect to live 9 full years less than a child born in Hawaii. 37 rural hospitals, 55% of the total, are at risk of closure. At Greenwood LaFleur Hospital in the Delta, once a 200-bed facility, a doctor described the collapse. It is really sad to walk these empty halls and to see that we only have one part of one floor occupied with patients. The hospital lost neurosurgery, urology, labor and delivery, and its ICU. A patient named Kimball said it plainly. If the hospital closes, there will be a lot of walking dead. Folks will be sick, sick, sick. Mississippi is not failing. It was never funded to succeed. The state has never expanded Medicaid. Nearly half of Mississippi-born college graduates have left. Would you move to a state where the nearest emergency room might not have a doctor, the nearest hospital might close next year, and having a baby carries 5 times the mortality risk of California? Drop your answer in the comments. You just sat through 5 states where going to the hospital is genuinely more dangerous than it should be in the wealthiest country on earth. If you are planning a move, this is the stuff your real estate agent will not bring up. Subscribe so you see it before your lease is signed. And if you are already in one of these states, well, now you know.